Thank you, everybody who has joined this meeting from Australia as well as from afar. And I welcome Mr. Mohamed Mohideen. I am speaking on behalf of Sri Lanka Covid Aid, which is an organization based in Australia. Let us first acknowledge that this webinar is being conducted from the traditional lands of the First Nations of Australia, the Wurundjeri people of the Kulin Nation, the traditional custodians of this land. We pay our respects to their elders, past, present, and emerging, and the elders of other community. Well, we know that Australia, especially New South Wales and Victoria, those two states have been affected by what is going on currently with regard to the pandemic. It's getting worse. And as Sri Lankans, of course, we are very worried about what is happening in Sri Lanka as well. And I think we all need to take this opportunity to share the grief of many Sri Lankans as well as Australians at home or abroad who have lost their family members, colleagues, and friends due to the spread of the current pandemic and the devastation it has caused. Our thoughts are with them wherever they are during this difficult time. We wish all of them peace, comfort, and courage to face the days ahead. Our speaker is today Mr. Mohamed Mohideen. He has been a volunteer for more than 2 decades, as far as we know, and he is a very good friend of all our activities, Sri Lanka Covid Aid especially. And he has been the president of USMA, United Sri Lankan Muslim Association of Australia, so many times.
5 times.
Yeah, and he was an academic at Monash University for a long time. And he has served not only the Sri Lankan Muslim community, the Sri Lankan community in general, as well as the wider multicultural community. He has served very well, and he has been recognized for his work in that area. And now he is the head of Priority Communities Engagement Unit in the COVID-19 vaccination program of the Department of Health. What has happened is, due to the current developments, there are many misconceptions, many rumors being spread, and some are very mythical, some are not scientific. And then, there are people who are very hesitant to get vaccines, and sometimes they don't accept even that COVID is a pandemic. And this has created a bit of a chaotic situation, not only in Australia, I would say, even in Sri Lanka. Some of my very good friends, they don't believe COVID exists. So I don't know what to do because I can't convince them. So I think when Mr. Mohamed Mohideen made the request that we should have a consultation with the Sri Lankan community, I was very pleased. And as the convener of Sri Lanka Covid Aid, I thought this will give us a very good opportunity to clear up some of the issues we have. And there are many concerns and many doubts, and this will be a very valuable opportunity to clear up those concerns and doubts. So without much ado, I will invite Mr. Mohamed Mohideen to share his thoughts about the whole vaccination program and about the behavioral aspects of the people in our communities. And so over to you.
Good evening, friends, and it's great to be with the Sri Lankan community, being part and parcel of the Sri Lankan community as well. Also like to begin by acknowledging the traditional owners of the land we meet on and pay my respects to the elders, both past, present, and emerging. This land will always belong to the First Nations people, and we are guests in their land, and we are now part and parcel of the Australian culture. As a Sri Lankan, I would also like to acknowledge that we are sad about what's happening in Sri Lanka with regard to a number of people dying, and all our love and prayers are with the people of Sri Lanka during this time. The way I would go about this presentation is I'll give you a background of COVID itself. I think we all know what COVID is, but sometimes it might be a reminder to see what we understand and how this affects us as individuals. So most people who get COVID will have a very mild to moderate respiratory illness, but it can cause harm in some people. It can lead to pneumonia, which is a common aspect. It can also cause what is known as acute respiratory distress syndrome, which would need you to be then hospitalized and needing oxygen, and also being intubated and also on a ventilator. And this, you end up in the ICU. It can also cause sepsis, and this is something that we hear these days as long COVID. People recover from COVID, but the damage that the virus does to the lungs and other organs is lasting. So we are still going through and seeing people who, after recovering from COVID, are suffering from post-COVID symptoms. It also is we can have super infections. This is our microorganism. I just need to give a background. I'm a microbiologist. I'm a clinical microbiologist by profession. Before I joined the Department of Health, I was at Monash University. So I'll talk to you more from a microbiology point of view as well. So we all carry microorganisms, and with viral infections, we can get secondary infections from our own microflora. And this is what happens sometimes after COVID infections, which is caused by the virus. You can also end up with that secondary infection. We all know that the virus is spread by droplets of saliva or discharge from the nose. And this is why we are asked to sort of cover our nose or shield ourselves when we cough or sneeze if we do have an infection. This virus, the incubation period is approximately 2 to 14 days. This is why you'll find that if you have been to a tier 1 site or you've been exposed to somebody who has COVID, you're asked to test and quarantine for 14 days. And also, if you're traveling from overseas, you go into hotel quarantine for 14 days. But what we are finding is with the newer strains, the mutant strains, that sometimes the incubation period can be longer. So this is why people traveling from overseas are also tested on day 16 and day 21. Some people can be asymptomatic, so they will not show any signs. And this is one of the problems we have, that people could be infectious while in the community with showing no symptoms. So what we know about the number of cases worldwide, there's over 214 million. This is the stats from yesterday. 4.5 million deaths have occurred across the world. So if you look at roughly the mortality rate, it's about 2.1%. If you look at Australia stats, we have had 44,922 cases. We have had 984 deaths. Every day we see deaths in New South Wales. And again, the percentage is about 2.1%. If you compare this percentage to the flu, there's greater infection and death due to the COVID than the flu itself. So people sometimes say, oh, there's more deaths due to the flu, but when you look at the comparison rate of deaths versus cases, this is 2.1%. So if we were to look at the COVID itself, one of the key things we need to understand is the vaccine alone is not the answer. This is what when I hear some politicians say, get vaccinated, and we'll be out. That's not the real only answer. It is a holistic approach that we need to take. Wearing the mask, which in Victoria is mandatory. We have to wear the mask whether we are inside or outside. Making sure we wash our hands thoroughly each time. Humans in general are seen to be, they touch their nose or face or eyes every 3 minutes. This is stats that they found out. And when we touch various surfaces where people would have sneezed or coughed, sometimes the viral particles can be there and we could also get infected. We also need to QR code. This is been pushed a lot to all people. The reason for QR coding is that from the Department of Health, we can do the contact tracing. If you have been to a tier 1 site where a person who's infected has been there, by this information that is by the QR code, we can trace the person, ring the person up, get the person tested, and then ask the person to quarantine as well. So this is important. You might think it's cumbersome and it's too much of a hassle, but please QR code wherever you go, whether you go to your little newspaper shop, or you go to a supermarket, or you go to a shopping center, or you go to a place of worship, QR code. Now in Shepparton, we are having a problem. We have over 90 odd cases in Shepparton. In the recent past, some people have been going to a community gathering for 5 days, and some of them have not been QR coding. So this is why people are now having symptoms and in the community and also spreading it without getting tested. Now, if you were to look at the symptoms of COVID, it's very similar to the flu, and also it's very similar. We are going into the hay fever season. We are going into spring, which is the hay fever season. So things like sore throat, shortness of breath, cough, runny nose, and all they are associated with general flu and also hay fever. The only thing that is very particular to COVID is the loss of smell and taste. So if you have any of these symptoms, you should get tested. Don't consider that to be just your cold or flu. Get tested. And if you are negative, you can leave home and you don't need to be in quarantine. If you're positive, then you and your family will have to quarantine for the 14 days. So the quarantine period is important. If you've been to a tier 1 site and identified as a primary source, you must test and quarantine for 14 days. So you get tested on day 1 and you'll get tested again on day 13. And if you are clear, you can then leave your home and you're out of your quarantine period. People who are considered secondary source or who are come in contact with you who have been a primary contact, they need to test and quarantine until their results come. There is financial help being offered in Victoria. You can get $450 if you are a casual worker and you need some funds. You can get $450 while you're waiting for your results. If you are a full-time and you are quarantining for the 14 days, you can apply to Centrelink for $1,500 for that period of 14 days. The Australian government made a decision that every single person on Australian soil will receive the vaccination and testing free. Be it you're a citizen, a resident, a tourist, a student, if you are a refugee on Australian soil, if you don't have insurance or a Medicare card even, you will be given the vaccination and testing free. Now, in Australia, we have roughly given about 18.7 doses of vaccination. This is both Pfizer and AstraZeneca. In Victoria, we have surpassed 4.8 million doses, and we are hoping to go beyond 5 million over the next 2 days. If you look at the worldwide stats, we have 5.18 billion doses have been administered. There roughly is about 17 different vaccines available in the world, and we know that 33% of the population has at least had 1 dose. Now, if you were to look at the SARS virus, it belongs to the family called coronavirus. The reason that it's called a coronavirus is because of these spike-like proteins that's on the surface. So it belongs to the same family that we had SARS, and that came out a couple of years ago. Then we had MERS, which came out from the Middle East. They all belong to this family called coronavirus. At the moment, we have 2 vaccines to be used in Australia. We have the Pfizer vaccine, which is also called Comirnaty. It is an mRNA vaccine. mRNA vaccines are not new to the world. Research was started in 1961. The last vaccine, mRNA vaccine to be used was the vaccine against Ebola. The Ebola vaccine is an mRNA vaccine. We have the traditional vaccines, the AstraZeneca vaccine, which will from very soon be referred to as Vaccination. It is the traditional vector-based vaccine where you use a non-pathogenic strain of a virus. You incorporate the genetic material, and then that is injected to the person. So both vaccines achieve the same objective. What it does is it creates a spike proteins in your body, and then your immune system gets kick-started, and it produces the antibodies which fight back against the virus. Now, within a few days, within 2 weeks, it takes about 2 weeks to build up that immunity, and then it remains in your memory. So if you do get an infection, then the memory kickstarts and produces antibodies to fight back. So in Australia, over 8.8 million doses of AstraZeneca have been given. We are also going to have 2 other vaccines which have been, one has been approved by TGA. It's called Moderna. Moderna is going to be here end of September or early October. Moderna is similar to the Pfizer vaccine. It's an mRNA vaccine. We also have purchased 53 million doses of Novavax. We will hopefully get Novavax by next year. So next year, we should have 4 vaccines available for people to use or have a choice. Now, since the time of the pandemic started, way back in 2019, the virus has mutated. This is a very common property of all viruses. If you take the flu virus or any other virus, they tend to mutate, and they mutate in the human body. So initially, the viruses were labeled by a scientific terminology. It was referred to from B1 to, like you can see the numbers, and can you imagine us referring to Delta as B1.6172? We will be very confused. Then they started calling them by the country where the mutants originated. again, that caused some backlash. For example, they had, like even here in Australia, they were referring to the Indian strain. When the Delta strain originally came, they referred it to the Indian strain. There's backlash on those communities. So WHO decided to rename all the virus strains, all the mutant strains, by Greek alphabets. So today we have from Epsilon to Delta. The four key strains that are of concern to the world is the Alpha, Beta, Gamma, and Delta. The last outbreak we had in Victoria in July, we had the Alpha strain. Today, the whole world is dealing with the Delta strain. This strain is very virulent. It spreads very fast. You don't need to have close contact. Like remember in the beginning of the outbreak, you had to have been exposed to a person roughly about 15 minutes. That was a standard time that was given. With the Delta strain, a person fleetingly passing by can end up with you picking up the virus as well. So that's the thing with the Delta strain. So the good thing is that both vaccines are very effective against the Delta strain. Now the viruses are not going, these mutants are not going to stop. We have 11 mutants that are here at the moment. There is already the 12th mutant that is starting to spread up from Chile. It's called the Lambda strain as well. So as we move on, it's not going to stop. We're going to have more mutants from this particular COVID virus. So it is something to think about. And this is where continuous research and continuous advancement in the vaccine development is important. So like all vaccines, you can have some side effects. They are generally mild, and sometimes it can last for 1 day, or sometimes 2 days, or maximum of 3 days. So some of the most common side effects are pain, tiredness, headache, aches, and fever. You can see the fever is very low. It's about 4 to 8%. With Pfizer vaccine, it is seen normally after the second dose. And with the AstraZeneca, it's normally seen after the first dose. But this can alternate as well in some people. And in some people, you might not see any side effects. For example, I had the AstraZeneca vaccine. I had no side effects after my first dose at all. Now, one of the key things that people are concerned, and the medical profession is always concerned, is the anaphylaxis reaction to any sort of treatment. And here, the anaphylaxis reaction or the strong allergic reaction can occur within the first 15 minutes. And again, it's very rare. It's like you can see Pfizer is greater than AstraZeneca. And this is why when you go to get vaccinated, you are asked to remain at the surgery or at the mass back sites for 15 minutes, because if you were to get an anaphylaxis reaction, you will get it within that first 15 minutes. So immediately you have the doctors on site, you have the nursing professionals on site, you can be treated and be helped as well. So please, if you do go to get vaccinated, I know sometimes you have to stand in long queues, but when you get there, get vaccinated, remain for that 15 minutes, which is expected. Now, this is a concern that lots of people have raised because there's been a lot of information out there about this is thrombosis with thrombocytopenia syndrome. This is called the TTS syndrome. Symptoms, and this is seen after some of the vaccination, and in many cases it has been seen after the AstraZeneca vaccine after the first dose. It's very rarely after the second dose, it's seen after the first dose. In Australia, as I mentioned, we have had 8.8 million doses of AstraZeneca given. We have had only 64 cases of TTS, and unfortunately only 5 people passed away. Again, we have now been able to understand more about what TTS is all about and some of the symptoms that is seen, and these symptoms can develop between the 4th to 30th day after immunization. So it's severe or persistent headache, blurred vision, confusion or seizures, shortness of breath, chest pain, leg swelling or persistent abdominal pain. You can also have bruising around or pinpoint spots around the vaccination. So if you do develop any of these symptoms after the 4th day and before the 3rd, please seek medical attention, medical support. It is important to see your doctor, and if you need be, then go to the emergency. This again, TTS is very rare. Or media has made a big fuss about it. It's very rare in Australia. If you compare the risk of blood clots from the vaccine, it's 0.0004%. Getting COVID and getting clots is 16.5%. I've given you about birth control and smoking as well, how you can get. You can see it's much higher getting COVID and getting so if you weigh the positive nature of the vaccine, it far exceeds the getting clots due to COVID itself. So there is support, there is help available, and it's a very rare occurrence. So again, as I said, 8.8 million doses have been given since yesterday of AstraZeneca in Australia, and we have had only 64 confirmed cases, of which only 5 deaths. So as on 24th, before when we started the vaccine process, one of the key things we had the biggest problem was the supply. The demand was greater than the supply. The federal government is in charge of getting these vaccines. We did not have such a large supply. So what they did was they staggered who was eligible for these vaccines. So initially we had a whole group of people, from frontline workers to the elderly people, people with disability, and all of them were given the vaccine. Now from the 25th of August, every single person is now eligible to get the vaccine. So the vaccine is available for people over 16 and above. So up to the age of 59, you will be your preferred vaccine will be Pfizer. You're given the option of getting Pfizer. If you have already had the AstraZeneca vaccine and you're under 59, your second dose, you can opt to get Pfizer. If you prefer to get AstraZeneca, it is still a good vaccine and very effective. You can take it. People over 60, AstraZeneca is the vaccine of choice. If you have had a very severe adverse reaction to the vaccine, through your GP, what you would do is apply to the Victorian Specialist Immunisation Services, and they will make a decision whether you would be given the alternate vaccine. It can be due to Pfizer as well. We know there are some side effects of Pfizer as well, and I'll mention that in a few moments. Children, ATAGI, which is the key body that approves all treatment in Australia for various treatments, and they have approved Pfizer to be given to children 12 to 15 years. They have approved, at the moment, it is only being given to children with specific medical conditions with increased risk of severe COVID. So it's people with severe asthma, diabetes, obesity, cardiac and circulatory and other illnesses, and also the Aboriginal and Torres Strait Island children as well are being given. The rest of the children in the age of 12 to 15, they have not decided when they would start. It may be in a month or two when we have a larger supply of vaccines as well in Australia. Now, at one stage in June, before June, pregnant women were not, who were planning to get pregnant were advised not to take the vaccine. There was really nothing wrong. They were waiting for more results, more studies to be done. So today, WHO world authorities have all approved that Pfizer can be given at any stage of pregnancy. You can also take AstraZeneca if you want to. So women who are trying to get pregnant can also take the vaccine. They don't need to delay pregnancy. There's a false statement, a rumor out there in the wider community saying that by taking the vaccine, both males and females will have it'll affect it'll make them infertile. It's false. It's not true. There is no such scientific evidence or medical evidence to support that. So it is considered that it's better to get vaccinated than falling sick, especially when they're pregnant. So women who have received the first dose of AstraZeneca and who could have fallen pregnant can either take the second dose of AstraZeneca or take Pfizer. Now, they've also found that this is studies done in states. They've done a lot of studies. They've found that the vaccine will give indirect protection to babies by transferring antibodies from the mother through the placenta or through breast milk as well for breastfeeding women. Now, this is a question asked by a lot of CAL community, and especially for us as well. A lot of us travel, a lot of us come from overseas, from Sri Lanka as well. People returning to Australia from overseas who have received a first dose of COVID vaccine, either Pfizer or AstraZeneca, which is, if it's been given in Sri Lanka or anywhere else, your second dose will be the same vaccine. If you have had another type of vaccine which has been approved by WHO, if you go to the website, WHO has approved certain number of vaccines. If you have had one of those vaccines, the first dose, or even the second dose, that will be acknowledged. And if you had the first dose, you'll be given the second dose of AstraZeneca or Pfizer, depending on your age group. But if you have had a vaccine, either first or second dose, which is not approved by WHO, you would have to be immunized from beginning here as again. So the immunization is generally 8 to 12 weeks for AstraZeneca between the two doses, and 3 to 6 weeks for the Pfizer dose. Sometimes it can be delayed, and again, we can go up to 16 weeks for AstraZeneca or even 12 weeks for Pfizer. So in Victoria was one of the first states to open mass vac sites. We not only have mass vac sites, we have drive-in vac sites, we have pop-up sites as well, which have been created at different places depending on the need and demand. So you can either go to the website, the portal cvms.vic.gov.au, or call the 1-800 number 675-398 and book your vaccine as well. Now, GPs and GP respiratory clinics are supported by the federal government. So if you can still get your vaccination, you can ring them up and book your vaccine as well. Sometimes people might have a problem of getting to any of the vaccine sites. If you have a disability which stops you from getting out of the house, you can, through your carer, ring up the disability liaison officers, and that's the email address and online form. I share these slides with Lionel so he can share it with you. And you can make your booking and they will make arrangements to get you vaccinated. Now, as the department, one of the key things is that we want to work with the community because the voice of the community is the strongest. So we have built up a whole lot of community people who are working with us, who are considered, we call them vaccine champions. So what we've done is we have trained them, we take them through various training programs. If any of you are interested in being part of that program, you're most welcome to email me and I can send you the forms. You learn about how to answer some of the questions, especially the basic questions, and also how to talk to people about who have vaccine hesitancy. The key thing is to build up vaccine confidence. We are trying to answer all these questions. We're asking people to talk about their personal stories. We had a lot of stories in my presentations to various groups. I've heard plenty of stories of the positive nature that people have been scared initially to get vaccinated. Once they got vaccinated, they are so comfortable and confident of not getting infected as well. So advantages of getting vaccinated is it's effective. You must have both doses to build up 90%. The first dose will take you to about 60 to 70%. It is after the second dose that you'll build up immunity to 90%. There's again a false statement out there in the community that getting the vaccine can give you COVID. The vaccine will not give you COVID at all. There's also false stories mentioning that the mRNA vaccine will change your DNA. Your DNA is protected totally. The mRNA cannot do any damage to your DNA as well. Again, as I mentioned, it takes 2 to 3 weeks after the first dose for people to build up immunity. And this is why it's important, and we are encouraging people to get vaccinated early because that will build up. There's no point waiting until somebody in your house or your neighbor is got infected before rushing to get vaccinated. So get vaccinated early and build up immunity. So if you're already infected, the vaccine is not going to cause any harm, or it's not going to reduce the infection. We all know with viral infections, vaccine is not a treatment. There is no real treatment to stop the spread of that infection. It is your immune system that gets kick-started, it produces antibody, and then we recover. We do not have antibiotics that will target a viral infection. So it's important to take the preventative measure. The vaccine is a preventative measure. If you have had COVID, you're advised to stay for about 6 months before you get vaccinated, because you will have your antibodies in your body, which you have developed against the infection you had. And that might last for about 5 to 6 months. So you get vaccinated around that time. Again, just to end, there are over 5 million doses of vaccines given. It is safe, it's monitored. We have TAGI and TGA that monitors this. Safety issues are very rare. Again, people must talk to their GP if they have any comorbidities, because only your doctor will know what illnesses you carry. So talk to them, discuss with them, and make the informed decision. Again, don't get misled by Google. There's a lot of false information out there, and we know, I've heard a lot of my Sri Lankan friends telling me a lot of stories, and I've spent hours talking to them as well, trying to clear and remove all those doubts in them. So we are running this session next on the 9th of September. This is run by Professor Margie Danchin. She's a pediatrician and she's a world authority on vaccines. She works at the Murdoch Children's Research Institute. Again, she runs this 1.5-hour training program to teach people, especially leaders in the community, how to talk to their community, how to build up trust and confidence, and so that people would go and get vaccinated. These are some various links to the site. And finally, the Premier announced a few weeks ago that there's 1 million reasons to get vaccinated. He wants to hit a target by mid-September to get 1 million doses done. We are really got lots of people getting vaccinated these days. Lots of people have come forward. And the more we get vaccinated, the more we build up immunity as well. So thank you very much for having me, and I'm happy to take any questions from now.
Thank you very much, Mr. Mohideen, for that enlightening presentation. I think discussed many issues, many concerns and the communities have with regard to the virus, vaccines, and so on. So let us go for the Q&A session. And there is a question raised by Dr. Willie Serenite in Canberra. Why COVID-19 is more virulent and rapidly spreading compared with SARS and MERS?
With SARS, I think it was to a certain extent contained. Like when you talk about any infection, we have 3 stages, we refer to them. Epidemic, which is localized and a small area. We have endemic, which can be in a bigger area. And then we have pandemic. SARS was never labeled by WHO as a pandemic. So SARS never spread right across. And with COVID, what we find is even fleeting contact is enough to spread this virus. And as it mutates, we have found that mutant strains are spreading much faster. The Delta strain, like as I mentioned initially, when you talk about the initial COVID strains, you need to have been exposed to 15 minutes to the person. Direct contact was what it was. As the mutant strains evolved, like especially with this Delta strain, we know, for example, if you look at in Victoria at MCG, where the person who was infected was in one stand, there were people on either stands far away who also got infected. And remember, there were cases where in the hotel quarantine, where the first few cases came, our first Victorian case was that this person was infected, came out of his room, collected something from the door, went back, another person came out of his room and got infected. So this virus is spreading very fast. It's picked up by people very fast as well. Each virus is different. Unfortunately, we are dealing with a virus that spreads very, very fast in people.
Thank you. Siti has asked a question, Siti from Melbourne. I hope she's from Melbourne, yes. What measures, because there are 2 cities, one is from Sydney, one is from Melbourne. What measures do you have to take to control the virus in Melbourne? The cases keep increasing daily.
The reason, there's one aspect of it that we need to remember. With the initial COVID infections, when one person in the house he could quarantine in the house and no one else got it. Today, with this particular Delta strain, if one person in the house gets it, the whole household gets it. So when you look at numbers per day, so if there's a person who's got infected in the house, you can rest assured, you can bet that everyone in the house will get infected. Another thing what we are finding, this is our various communities, it's across all communities, that some people, because of various financial reasons, because they know the moment they got tested and they're confirmed to have the virus, they would have to quarantine and the whole family has to quarantine. People are day wage earners. Some of the people are refusing to go and get tested. So they are remaining in the community. Like even today, if you look at the number of cases, it still mentions a certain number of cases have been in the community. So we as people, we as Victorians need to take this responsibility seriously. I think we need to, if we show, as I said, any signs, get tested and quarantine. If we don't do that, it is going to spread. However much lockdowns and various things are put in place, if we do not follow the rules, we do not take care, it will spread. So the only way that we can do is that every single person takes that responsibility, because as I always say in all my forums, we are not only responsible for us, our immediate families, but we are responsible for the community at large. And this is what is happening. Today, we know children get infected. We are looking at New South Wales. There's over 700 children who are infected. And this is why in Victoria also the schools are shut down, because if they pick it up, they bring it home, they can spread it. Same thing with adults. So the good thing is now lots of people are getting vaccinated. We know with vaccines, you're not going to prevent getting COVID. 90%, it's a 90% efficiency. You can still get COVID after getting vaccinated, but we need to take protection like wear mask, make sure we keep our distance. We do not go to crowded places. If there's a tier 1 site, we keep away from those sites as well.
Thank you. Are there any questions from others? And you could unmute and ask the question, one person at a time.
Mangala has asked a question. Lionel?
Mangala?
Yeah, yeah, thank you. It's a very informative session. Thank you very much. And I know that Sri Lankans were given Sinopharm, the Chinese vaccine, and will Australian government recognize that vaccine if Sri Lankans are returning, or Australian Sri Lankan returning back, or will there be a different process for their vaccinations?
At the moment, the Sinovac has been approved by WHO as emergency vaccine, so Australia will recognize that vaccine.
Okay, thank you.
Thank you. Nalika?
Right. Thank you. And sorry, I was typing my question.
No problem.
Well, the national government says, they're focusing on 70% vaccination. So that means there is another 30% without any, vaccination or protection. So, what's that mean? What is the impact? Spread the virus, and also, we know now there could be other mutants, the variations can occur. So what is that impact? What's that mean?
Yes, thank you for the question. It's a good question. If you watched 3 days ago, I think Sharon Lewin, who is the head of Dorothy Institute and who's the key architect of the Dorothy report, clearly in an interview mentioned that when the report was made, that 70 to 80% rate of vaccination also includes that we have a number of cases of less than 30. Because one of the key things is if you do open up and you have cases, you also need to have the hospital system to be able to cope with that, with people who need to be hospitalized, either do fall sick, who are unvaccinated. Now, if you start with such a high rate, like Sydney is having over 1,000 cases per day, and I think it's nearly reaching about 10,000, if I'm not mistaken with numbers. So opening up and allowing people to just move about freely, you can imagine the number of cases. Like Sydney hospitals are at the brim. They are finding it difficult to cope. So she talks about that it's not only the vaccination that is the key factor, it is also the medical services that should be there to be able to look after these people if they come. So that's why you can see Victoria is taking a very conservative approach. They do talk about 60, 70, 80%. And you see even some of the other state premiers have said, we are not going to open up because we are free. Like, for example, Western Australia or Queensland, they said they're not going to open up because everyone is talking about 70, 80%. So again, today I was listening to another epidemiologist who was talking about this 70, 80%. So there's a lot of questions being asked at the moment, whether this large numbers, is it ideal to open up? Because even having 20%, say that, for example, we reach 80% rate of immunization. We know that even with immunization, you can still pick up COVID. You might get a mild attack and you won't be ending up in hospital, but we still might have that 20% who will need, if they get infected, might need to end up in hospital as well. So it's still debatable. This 80% is still debatable, 70, 80% of opening up. So this is something we'll have to wait and see how we proceed going forward.
Thank you. Any others?
Hi, Dr. I'm Damita here.
Yeah, Damita.
Thanks for the presentation. Just a quick question. I mean, in terms of, as you correctly mentioned, vaccination or one particular, I guess there's no one particular solution for this problem. But having said that, even within Australia, state-wise, we have different, I guess, ideas and expectations and ways of dealing this situation. Say, for an example, even if Melbourne is closed, and I guess a lot of people are if Victoria is closed and a lot of people have to sacrifice their jobs and all of that, but if New South Wales is open, that's not going to help as a country. And at the same time, we saw not just within the country, from New South Wales, it went to New Zealand, and like through countries to another country as well. So what is the factor that it's stopping for Australia to I guess given it's a pandemic situation, to take like a solution, or like a one single, I guess, pathway to come out of this situation? And what do you think that would be the most ideal thing in terms of this kind of situation, rather than having to deal with state by state?
Yeah, thank you for the question. It's a good question. It's something that the politicians need to make decisions on. That's why there's a national cabinet. But at the end of the day, each premier is responsible for their state and protection of their state. Like Victoria came out very fast. We went with the hard and fast lockdowns, and we came out initially we came out of this particular pandemic as well very fast. But unfortunately, then we had people who came down from Sydney and infected people in Melbourne and even the country Victoria. So every state, I think, will make the decision what is best for, and every premier will make the decision of what is best for their state, because they are elected reps and elected governments of the state. Although there's a federal body, but the states make decisions with regard to health aspects of their citizens as well. So it's not a one solution that will fit everyone, because New South Wales is taken a very different approach to the whole pandemic. Victoria has taken a different approach. South Australia took a different approach. Queensland took a different approach. And today, Queensland is free of any cases. Western Australia has just got 2 cases because of the truck drivers going across who were infected. So again, I cannot give you one answer that will fit the whole country, because each state is different in this aspect.
Thank you. I will give you a chance to Professor Siri Hettige. He is from Sri Lanka. Siri.
I hope I can ask this question, because it's not relating to Australia. It's relating to the COVID situation in Sri Lanka. I hope, if you don't want to answer that question, you are free to do so. My question is, we have a dilemma right now with the lockdown, and that is because there are 2 arguments, one against and one for. The people who argue against the lockdown, particularly people who are in government, they argue that the majority of the people are dependent on, let's say, the informal income sources, and therefore, if you really have a real lockdown, which we didn't have anyway in Sri Lanka. If you have a real lockdown, you will, really make life very, very difficult for a majority of the people. But only argue, especially the medical specialists argue, that unless and until you have a lockdown, and of course we didn't have a proper lockdown, but if you at least some form of lockdown, you're not going to really contain the the pandemic. Now we are in a dilemma, and as you know, the situation is really spreading very rapidly, and we are all homebound. And of course, if you step out and look at the streets, there are so many people moving up and down, and so on and so forth. So we have a real dilemma. If you really want to respond to this, how would you respond?
Okay, I'll go.
You're free not to do it, but
I can give you what's happening in Victoria. We have a lot of people, especially young people, who are daily wage earners, who have lost their income sources as well and lost their jobs and all. When we had the first, last year, when we had the big wave, the federal government stepped in. Like, this is where the government stepped in and offered them, they were offered payments. Like, there was the $1,500 a fortnight, which was offered to support them during the pandemic. So that it was called the JobKeepers payment, and that was given for nearly over 1 year. That was offered. And even now, for example, in Victoria, we are in lockdown, lots of people, and this is why we have had few protests, not only in Victoria, in New South Wales as well, and in some other states, because especially with like tradies and daily wage earners, they feel that they have lost their source of income, and there's a lot of hardship. But the state government and federal government have stepped in to support them. Like as I was mentioning today, if you are in quarantine for the 14 days, you can apply to the Centrelink. We have the welfare system, which offers the person $1,500 if they qualify to get. If you get tested and you have to quarantine for the 3 days and you miss out on work, and if you are a day wage earner, you can claim that $450. So that is the only way the government needs to step in and support those people. The lockdown is important because that's the only way you can contain, because if you do not lock down, people who are infected are going to go into the community. And we have when we talk about the COVID multiplying rate, you call the R factor. And if the R factor keeps going higher and higher, so then for every person who is infected, you have 1+, then 2+ or 3+ numbers getting, and it's spreading, and then it's never going to stop. So what Victoria went with is the hard and fast. Like the best example is South Australia. They went in for a very sharp lockdown, and they basically got rid of all their COVID cases. You're never going to get zero. Virus is never going to be got rid of. Like for example, we can talk about the polio virus. There was the world opinion to get eradicate polio. We still have polio with all the billions of dollars spent on it. So we are never going to. We are going to learn to live with this virus. I think this is something we are going to be vaccinated maybe on a yearly basis. It might be like the flu vaccine. We take a vaccine, but when we are in like outbreak mode, what we are in and what Sri Lanka is also facing, I think sometimes the harsh decisions have to be taken, because our premier has gone down the track saying life is more precious than the financial implications. We can always come out of this and be like build up. But if you lose lives and people who have lost loved ones, you have how do you answer to that is the key thing. So I think that's what here in Australia, each state has taken a different approach to this whole even containing the pandemic. I hope I answered your question.
Thank you.
Sorry, and Dr. Loin.
Yeah,
sorry.
Okay. Dr. Sri Gaurasankar.
All right. Good evening, and Mohamed. It is very, very informative presentation. And the question what I was about to ask, you answered all. The question is, okay, you said we had alpha variant and the mutant and the beta, gamma, delta, and you said we are going to get the lambda variant very soon. So the vaccinations, what they have developed now, do you think that is very much enough for us to face the new variant, or how often we need to get this vaccination, or maybe they're upgrading the vaccinations every year or every 6 months or every 2 years? So it looks like there is no end for this new variant or new wave. So how do you think, or how often we need to get vaccination, or how often the vaccinations need to be upgraded to face the new?
Thank you very much. That's a good question. Like if you look at when the COVID vaccines, we are not even a year since the COVID vaccines came. It's around October last year that the vaccines came out. And if you look at what's been proposed by FDA and CDC in America, and even in UK, they are starting to think about giving the third booster shot of the vaccine to the elderly people in UK. They are doing the same thing in Israel. And they're also looking at in America that there'll be the third booster shot being given, because what they're saying is after a certain period of time, the immunity is dropping. So in order to rebuild that immunity, the third booster shot will be given. My gut feeling, this is as a microbiologist, is that going forward, we might be getting vaccinated on a yearly basis, like the flu vaccine, where each year, they sort of tweak it to target the new strains. So same thing with, I think, the COVID vaccines, that they will sort of work on targeting the new strains. So at the moment, the Lambda strain is not in Australia, but it is starting to appear in Chile and certain places in Latin American countries. So they will, I think, wherever the vaccines have been worked on, they will start, I think, tweaking, because it's a fine line of tweaking. Because when you're working with mutants, it's easy because you already have a vaccine. You know how to change structural aspects of it. So I'm sure, I think by next year we'll have vaccines that will target the newer variants that come out as well. At the moment, we are good with the vaccines. They target the strains that we have, and which is the Delta strain that is causing havoc right across the world at the moment.
That's great, Mohideen.
Thank you, Mohamed. Yeah, I will go to. There is a comment by Nalika Padmasen from New South Wales. She is the president of Sri Lanka Association of New South Wales. But before that, I will give a chance to Dr. Nilanga Samarasinghe from Switzerland.
Thank you very much for giving this opportunity, and thanks for the resource person giving this wonderful and very informative presentation. Just I want to add three points to the discussion, because one gentleman has asked about the differences between COVID-19 and the previous one, like SARS and all. I think the biggest difference is they are much virulent but less contagious. But the COVID-19 is more contagious but less difference. But I think that might be the reason we had very less number of deaths by SARS and all those days. And because of the rate of
transmission,
transmission, we are having many COVID-19 deaths now. The other thing is that I think that has raised by Nalika, about the 70 or the 80% of people after getting the vaccination, the Victoria or that province is going to open the country.
No,
then I think.
Sorry, this is the Dorothy report that has come out from the Dorothy Institute.
Yeah.
It's for the federal government that's working with the national cabinet.
Yeah. Then I think the government is going for that decision because of the herd immunity, because they are think that I think that that failed in England at the initial.
It failed in Switzerland as well.
Yeah, and in Israel also, because they have given I think more than 90% of people the vaccination, but still they are in the burden of the midst of the burden. Then then regarding the last one about the last gentleman has asked about the frequency of getting the vaccine if it is going on. Then I think here we have calculated that it might be between 6 to 8 months, or just around 8 months. Then we are hoping to give a booster doses in every 8 months. Still we are getting some sort of control of the actually the hospitalization and the death. If we can manage the other things, hopefully then it will be going another vaccination in our vaccination card every year we take.
In Australia, the TAGI has not still approved a booster shot at the moment. So because we are only at the moment we started vaccination on the 23rd of February. That's the day we started the vaccination in Australia. So we are still in our infancy stage. So we got a little more time before we think of a booster shot. We need to get vaccinated at the moment.
Yeah. So thank you very much for your very informative presentation.
Thank you, Dr. Samarasinghe. There is a comment by Nalika. I will just read it over. Currently, the vaccination is not mandatory. Therefore, the 30% of population could choose to not to vaccinate. On the other hand, employers need to make sure they are vaccinated. This is a very complicated situation for many employers. Health orders and choices and employer obligation. I think it's a comment. But if you want to...
Yes, so one thing, you can never make mandatory something that is not in supply. When people cannot get the vaccine, like, even now, if you try to make a booking, you're being given few weeks before you get a booking. So you only group that it has been made mandatory is the people who are working in aged care facilities. From the 14th of September, every person who's working in an aged care facility must have had at least their first dose of vaccination. Otherwise, they will not be allowed to work in any aged care facility. So that's the only group that it has been made mandatory. Maybe when we have abundance of supply, some companies might make it mandatory themselves, that if you want to work. I know, like, for example, some of the, in the meat industry, some companies that are exporting meat, those countries have required that the people who are working in the meat industry in that particular company have to be vaccinated. So it can change. Like we know, for example, going to the Middle East, like if we are going to Mecca, Medina for Muslims, we have to get the COVID vaccine now. So it might start becoming mandatory in certain areas, but at the moment, the federal government has not made it mandatory because we are not in abundance of supply. You cannot make something mandatory if it's not available freely for people to get.
Thank you. I think Dr. Srikal Shankar wanted to make an additional comment, but I bypassed you to give a chance to Dr. Samar Singh. If you want to comment, Dr. Srikal Shankar.
No, Dr. Lanka, I think he already answered my comment, because this is very silly clarification, because some of they were making some sort of joke and everything. If you drink alcohol, you don't have to get vaccinated. That will give you the kind of vaccine protection. But I'm not quite sure. And also some people say, if you drink alcohol, even you get vaccinated, that vaccination will not be effective. We don't know how far that is true or not. But sorry, Mohamed, it may be
it's fine.
Very silly question, but my friends are arguing with me about it. Okay, that's what.
No, don't worry. Remember, Donald Trump came out with a treatment, ivermectin. He was offering ivermectin to people, and we know that ivermectin is used to treat parasites. And it was so funny. There's a diagram recently I saw where ivermectin is given to animals, and it's to treat animal parasitic infections. And somebody in Florida or something had taken it and he died. So sometimes people assume a lot of things. Donald Trump, when he got COVID, never took ivermectin.
I don't know whether that's okay. Whether that vaccination and the people drinking alcohol and the vaccination is effective, or when it's going to be effective, or it's not going to be effective.
Alcohol will go into the liver. Alcohol will go into the liver and cause problems.
Okay, thank you. Is there anybody else who have any comments or questions? Okay, so I think we have discussed many aspects with regard to vaccinations and the required behavior of our people, in coping with the current pandemic situation. The crisis is worsening, so we all have to abide by whatever the guidance, sort of scientific guidance given by the government as well as our experts. And thank you very much, Mr. Mohamed Mohideen, and also I think from the department he was assisted by Mr. Pasu Sharma Lita, and we thank both of you for contributing to this presentation. And I also take this opportunity to thank everybody who have participated from Australia as well as from overseas, from distant faraway lands, and that was very encouraging, at least to show some interest in what is happening in Australia, and to understand what is going on, and also to apply whatever the experiences we can get in other countries like Sri Lanka or any other country. So I think it was a good opportunity for us to learn from our microbiologist, Mr. Mohamed Mohideen. He was very capable in explaining things, and so I wish we would be able to get over this pandemic, not in a zero sense, but at least sort of management sense, and we would be able to cope up with this situation. And we need to take care as the COVID pandemic escalates and devastates human lives everywhere. I thank everybody who participated in this information session. I think we didn't have much time to organize it, but during that short time, for spending some of your time of the weekend to get this information, we are very grateful. So thank you again.
Thank you so much.
Thank you.
Thank you.
Okay.
Thank you all.
Goodbye.
Yeah.
Goodbye.
Thank you, Lionel, for inviting. Yeah, thank you.
Thank you, Lionel. Thank you, Mr. Mohamed Mohideen.
Thank you, Mohamed and Lionel. Good night, all.
Good night. Good night, everybody.